Hello, this is Dr. Lakowski with Reimbursement Rx again, and we just want to go over a question. We received lots of questions recently about this new Medicare proposal to level off levels of service and pay doctors one rate, and as we mentioned, that it wasn't really good for physicians, and we're being asked why. And for those of you who are just coming out of training, you may not be familiar with how things work. Here's a very brief, quick and dirty rundown. In the office setting, you're probably going to use 4 levels of service, from 99212 to 99215, and those are the established patients. There's also codes for new patients, but we're just going to focus on established patients right now. There's 99211, which is a nurse's visit, which doctors don't use, and levels from 2, 3, 4 to 5. The higher you go, the more complex the patient is. Sometimes there's a time attached to it, but you don't have to use the time, and you need to use certain components of E&M codes and E&M components, documentation requirements, and we can talk about it later in greater detail. Right now, what's important for you to know is that when you see a very easy in and out patient, that usually is a level 2. When you see tiny, more complicated patient with a very stable medical problem, it's going to be level 3. The vast majority of your visits are level 4 and 5, depending upon your practice setting. Let's say you are a cardiologist and you deal with heart failure and arrhythmias. So let's say you are an endocrinologist and you're dealing with diabetes and hypothyroidism, or if you're a primary care doctor, you deal with it all. So of course, your typical patient will have at least 3 or 4 issues. They're going to be on 3 or 4 medications, and it takes time and it takes effort to make sure that they're being well taken care of. And you know what you do to them in the office, you're just helping them manage their chronic disease. And those are almost always going to be level 5 or level 4 visits. And for level 4, level 5 visit, of course, you're getting paid more than for level 2 and level 3. How much you get paid for that for Medicare? Well, it's very dependent upon your geography, depending upon where you are in the country. But it's very easy for you to look up nationwide averages. And the average for level 3, 99213 reimbursement, is probably around $90, and level 4 is around mid 100, 110, or something like that. Level 5 closer to 120. Now, the proposal is that you're going to be paid a flat rate regardless of how complex your patient is. So for instance, you see a heart failure patient with diabetes and atrial fibrillation. It's going to be flat rate of 93. Let's say somebody comes to you with a quick earache, takes you 2 minutes, it will be still $93, which probably be a little bit more than your previous code of 99212 and 99213. But complex patients, that's what we do. That's what all doctors do. And complex patients by far overweigh those easy ones. And what this new proposal will do, because commercial insurances will follow Medicare's lead, what that will do will greatly decrease your reimbursement, which is why it's very important for you to understand, especially for younger doctors just coming out of training, as to how this is going to affect your practice, your income, and your overall reimbursement. Thank you for watching.